There are conversations that we whisper, and there are symptoms that we hide. Here is the truth: shame does not cure infections, and silence does not prevent infertility. Sexual health is not a moral scorecard. It is a medical issue, and it needs medical attention. In today's episode, we'll be breaking cultural barriers to achieve clinical safety. My name is Sims, and I have with me.
Eniola. Ifeoluwa.
Praise.
And this
This
is
is Inside
Inside
Healthcare
Healthcare
Podcast,
Podcast,
where
where
every
every
voice
voice
matters.
matters.
All right. With us today is a registered nurse and a nursing tutor, Miss Ogunmola Oluwakemi. Thank you for being here. She loves working in the aspects of nursing administration and politics, and she's also an aspiring nursing administrator. And in view for our MSc is the nursing administrator. Thank you once again for being here.
You're welcome.
Welcome, Miss Ogunmola. So nice to have you here.
Thank you.
So before we go deeper, let's talk about the topic itself. The topic is let's talk about sexual health without shame. Hmm. Without shame. So I have two in one question. It's more like a two in one question. Number one, I feel like everyone's perspective is when it comes to sexual health is very different. And some people feel like it's sex, some people feel like it's more than sex, some people feel like it's infertility, some people you understand. So I want us to talk about this particular topic without shame. Let's just come out without shame. Let's say whatever needs to be said. So what exactly do we mean by sexual health?
So now, starting with the definition of health in a layman language, it's just the total well-being of an individual, regardless of the psychological state, the physical state, the spiritual aspects, and every other spheres of life. And so when we are relating it with sex, we're just saying that the total well-being of an individual concerning sex or regarding sex. So when we are talking about that, we are talking about the sexual life, the spiritual aspects, the emotional, the physical, the psychological aspects of an individual about sexuality or something around it. And in this part of the world that we have, sexual health is actually difficult to, like, most people are not outspoken about what sexual health is, and it's majorly because of the religious aspect, the traditional aspect. Also, we all see something like the name called sex, we see it as something like immoral, a dirty language. Yeah, if you see anyone, especially teenagers or young adults, talking about sex, trust me, everyone will firstly judge the person and be like, oh, this person is so shameless, the person is dirty, like you're having a vulgar language, something like that. So so sexual health is just so difficult to talk about openly because of the stigmas that actually attach itself with that thing called sex. And in the Western world, like I said, the part of the world that we have is very difficult for us to talk about it. In the Western world, even if you're not there yet, we see movies, we see news and everything about how they are open about it. You watch some American movies and you be like, oh, this 4-year-old boy is talking about kissing, sex, all those things. They're actually open to it. And trust me, because of the exposure they have around that thing, it gives them this sense of what they are to do and what they are not to do. But now, in this part of the world, let me use Nigeria, Africa or Nigeria for an example. If you should approach any college or university student saying, oh, what do you know about sexual health? Trust me, they'll be like, why are you asking me this type of question?
I don't want
You know?
trouble.
So that stigma is actually affecting the whole populace of this part that we have, and it's actually high time for us to be outspoken about it because a lot of things are happening that, assuming there's discussion prior to the exposure, trust me, a lot of things will happen if you're having adequate knowledge about sexual health.
Okay. So for me, another thing is, how does um we have, let me use Nigeria too as a case study now. When it comes to things like that, people in reality, people are kind of biased. When it comes to bias, oh, men can talk about it. If a lady is
Yeah.
talking about it, they'll feel like, ah, this girl only sheni, she's this. So how does it affect, for me, because how does gender affect health, sexual health? That's just my question. The stigmatization in quotes.
Yeah, so now when we're talking about sexual health, yeah, truly it's actually gender bias. Generally, it's gender bias because when growing up, you see parents when they're approaching their children to tell them things about life, they're going to place more focus on the female child than the male child because they believe that they are the one prone to the stigma.
Mm-hmm.
Yeah, because females are actually more prone to the stigma because they're the one that will carry the evidence of what happened.
Mm-hmm.
So there's this, oh, male child can, or the male populace can actually be exempted from everything about sexual health, whereas we have like them talking about the female. Now, traditionally there's this thing called FGM, female genital mutilation.
Mutilation.
So they
Yeah.
all believe that we have to do it for the female child to preserve their sexual health, whereas they're not focusing on
The male.
the male child. Also, now when we are talking about, but this thing goes both ways for both male and female. There are some people, males child or men that are actually prone to the abuse that comes with sexual health that majorly we are not focusing on because we are always like, I'm not saying we are gender biased, but most people in this part of the world are actually gender biased about sex, so they focus more on the female than the male.
Male.
But truly or in reality it affects the both genders, and the both gender actually face the consequences of what sexual health is generally.
All right. Thank you so much, Miss Ogunmola. When you started with that time, there's a question that I wanted to ask, which is, you said sexual health doesn't necessarily mean the health of someone sexually, like just sex alone. So you said it has to do with both the psychological part, the physical part, the mental part. Okay, in the angle of the psychology part, like what's the balance? How does sexual health has to do with our psychology?
Okay, so psychologically, we are talking about sex, for the intention or the act to happen. Trust me, we'll have think about it before the act. So, like your mind sets, your brain, like you've worked it out yourself, be like, okay, this is what we are going to do, this is what is going to lead, like all those things like that. So, psychologically, for sex, the before before the prior to the act and the aftermath of it. Now let's use this scenario: a young lady and a young man, they are like in a relationship. Now they've been in this relationship for a while. So now before sex, no, they will be like having this urge in between themselves. Okay, this is what we want to do. Okay, after the act, trust me, the reality might be different for the both of them.
Mm-hmm.
Like now, the male or the man actually enjoys it very well, and the female or the lady does not enjoy it. The psychological aspects, or when you are evaluating their psychology, like the aspects aftermath, is going to be different.
Okay.
So, and even in marriage couples also is always different. So like just it affects our mindset. There's this popular saying that if a married couple, if they have sex in the morning before going to work, they are always productive
Mm-hmm.
Okay. Really?
at work. Yeah, they always say that they are always productive. So it's the psychological aspect that, oh, I have a good morning.
Okay.
So that's why they are able to be productive out there and all. Assuming it was something like otherwise, okay, maybe the lady or the woman made advances and it was not approved by the
Yeah,
partner.
yeah.
It's going to affect the psychology, like
Okay.
the in fact the state of mind, the mood but the whole day might be ruined and all. So that's just it. So it's affects our psyche like very, 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 very well. Like it just affects us. That's it.
Thank you very much.
Okay, speaking about partners,
Okay.
regarding sexual health, a lot of people who are in a relationship, they mostly don't know how to tell their partners if they want to go for a test, or if they need to use protection during intercourse. Speak from the health perspective, which is your perspective. How would you advise a partner go about that particular scenario, whereby he or she has to tell the other individual about protection or about testing in the relationship? How would you advise go about it?
Yeah, like we've been saying, there's this awkwardness that comes with sex when we are talking about it. But I feel we in this generation, we just have to make this move, this motive of preaching it around, both in like in our workplace, in our church, in fact in our community. We have to start from the house or from our family. When we try to tell them, building confidence in everyone that you are supposed to like, you have this confidence of you saying this thing out. It's going to give us this boldness of, oh, I want to do this, I want to go for this investigation, I want us to do this, and it's going to give us this confidence of talking about it. So the awkwardness we have a long way to go about the awkwardness that comes with sex or sexual health in general. So that's just it. But I feel we are getting out of it. We might not be there yet, but at least we are going forward about it. It's not like when we were still growing up, when they used to
Because
tell us,
I know conflicts even arise between partners when one of the partners says, "I want to go for a test for this
yeah,
particular STI," or probably different kind of things. Even conflicts might arise. Even what's the name of this thing? Separation might arise from that particular fact. That because why would you not trust
Break
me
up.
to be faithful to you? Why would you think I'm out there? But no, testing should also occur in relationships.
yeah,
Okay, for me, let's talk about STI.
okay,
There's this still I'm not gender biased now. I'm just talking on behalf of. There's this thing that when we have two adults here that for sex, two adults are involved. But why is it that when it comes to STI, for example, after copulating and all, the let's say the guy has an infection or probably contacted it through that sex, or maybe they both had and they definitely don't know where it came from. Why is it that the blame is always on the lady? Like, oh, the lady infected me. Is it that it's just ladies that can have, girls, females that can have
Infections.
STI kind of? So that's my question, because now it's always, to me it always look like, because working in the hospital. Okay, let me give you a scenario. There was a time two people came in. They were both in a relationship as at then, and they wanted to do urinalysis and what's it called, vaginal swab, more like that. And the lady had to beg the doctor that the doctor she was talking to was also a female, that please, can you tell my boyfriend to go out first? If not, if I should say this in front of him, definitely there will be a separation. We will separate that day. So more like, oh, you would say, I infected him, and lo and behold, I am not sure whether because I don't have multiple
Partners.
partners. So
yeah. So we're talking about STI. There's this general knowledge about STI. A lot of people call this, let me say, infection. They will call it toilet infection.
mm,
Yeah, that's their layman language. And our hygiene also matters a lot
mm,
when talking about
STI.
STI.
sexual.
It comes in both ways. Both the male or the female can actually be a carrier
Career.
for
Mm-hmm.
this infection.
Mm,
And we always believe that female are more prone to, like
infection.
to
Infection.
infection, yeah,
Mm,
because of the way our genitalia is being constructed. So
mm,
we are like we are open to things like that. So we like there's this belief that females are the one that do like that carries and that they transmit it. And also the lack of knowledge also
Hmm.
affects us a
Ignorance.
lot.
Hmm.
Like the ignorance, yeah, ignorance affects us a lot about these things. You know, there are some things that they'll call vaginal flush or something like that that people are using to wash and all like that. You know, those things actually affect the acidity of our
The
liquid.
Yeah.
part, yeah.
And also all those things can affect it, and no, we just believe it. And also like being a faithful partner also matters a lot. Most
Hmm.
of the STI that happens are actually from different, like multiple partners,
Partners.
Hmm.
and sometimes the male partner can actually bring it from wherever they are.
It
And
shows,
you
yeah.
know this thing
Hmm.
runs in a cycle. This person cheated, went to another partner, so they are trying to
Contacted the
transmit
female.
it all around, so we can't even sometimes they can't
Pinpoint.
even trace it down to
Yes.
this is the major cause
Source.
or the source of this thing. So but we all just believe that because the female genitalia is being exposed, there's this belief that yeah, they are the one that carry it most. And like I said earlier, hygiene also matters a lot. Trust me, like you wearing dirty panties, boxers, and all those things also contribute to the transmission. But some believe like that their STI is STI until when they get to the hospital, get tested, and they get otherwise. That's when they know
Hmm.
that oh, it's not STI, it's just a normal infection
Infection.
or sepsis. That's just it.
So we've been mentioning STI, STI, STI. STI is actually, I mean, because of people that are not in the medical field. So STI is just sexually
Transmitted
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 infection
infection.
or STD
Okay. Or
disease.
STD. You can use D, you can use I. So disease. D is disease. Okay.
All right. I would say when two people are married, then there should not be any sexual health check at the hospital anymore. Is it clinically accurate, or how risky is it if they don't embark on sexual health checks because they are
Investigations.
married already and they believe they are both fit with one another? So
You know, nowadays people just go into relationship without even checking or knowing their partner
Compatibility.
wills. You know, and no before we always get these things in our religious
Mm.
organization. They will say that before you can approve yourself or before you can come to the community for your wedding or your marriage ceremony, you have to go to the hospital, do some tests
Yeah.
and or all those things like that. So um married couples, there should actually be a routine
Mm-hmm.
test, or let me say there is, but a lot of people just ignore it.
Mm.
The financial aspect is there, the ignorance is there, and let me say the faith that they all have in each other is there. Now I was saying the other time about the hygiene. What if the infection is coming from the aspect of you being clean or not,
Mm.
but they all just believe that oh, it's from sex. So married couple, we should, as health practitioner also, or let me say people that are into sexual health, there should be an awareness for people like us. We have these viral investigation, routine viral
Mm.
investigation. We should also have something called sexual investigation or something relating to that. So it's not going to be until when there's a need for us to check,
Mm.
but there should be like just be a routine one just to check to be aware. Okay, you know, now we are talking about when we are talking about routine tests. There's HPV ruling out the early signs of cancer.
Yeah.
So things like that should be done. There should be an awareness for the routine investigation for couples, for young adults, and all.
I wanted to ask, you've talked about hygiene as touching sexual health now, like two times. So I want to ask, are you saying that same STI does not necessarily mean that it can be contacted during sex? Are you saying, okay, probably our daily hygiene routine can also cause STI? Meanwhile, STI is sexually transmitted diseases or infection.
Okay, so now we're talking about infection. Let's use the disease, or let me use the infection from the STI. So when you're talking about infection, We're just talking about the contamination of like the normal floral,
Yeah.
Mm.
like the bacteria that are actually working actively for the betterment of the organs.
So,
So now there are a lot of things that can affect, that can infect it. So when we are talking about infection, we're just trying to be careful of, let's talk about the hygienic part and the screening part. Yeah, we have the blood, like the ones that can be contacted through blood, through just fluid, the hepatitis for an example. So we are just focusing on hygiene because hygiene is also play like an important role
mm.
when we are talking about sexually transmitted diseases or infection. So that's just it.
All right. Thank you so much. Then another question I have is, I'm sorry, I had to go to when you started from your introduction. You said sexual health doesn't necessarily mean the healthy part of sex, but like that to do with physical, like that psychological, mental. So at what stage does it look like one is not physically, or how do I put it? At what stage physically does it look like one does not have a healthy sexual life?
Okay,
Do you
so
get?
yes, I understand.
Okay.
So now when talking about the physical aspects of sexual health, for an example, um, let's use, things that happen in our mindset, like from inner mind. Later, sooner or later, it's going to reflect on our physical
Mm.
well-being
Yeah.
also. Now, someone is being affected. Maybe the person is actually experiencing abuse,
Mm.
Hmm.
sexual abuse.
Hmm.
The sexual abuse is coming from the genitalia, like the things like that. Even despite the person covering up, dressing,
Hmm.
late sooner or later, it's going to be evidenced by what
The look.
the look.
Hmm.
So that's why the psychological aspect also comes in. No,
Hmm. Yeah.
both works hand in hand
Mm.
about it. Like, and also now let's talk with, okay, when parents are trying to address
Their children.
their children, especially their female children, about sexual health. After talking, then trying to, I believe they're trying to tell us what to do and not
Or
what
what
to
not
do.
to do.
But now the fear can actually tell also in our physical well-being. Now they told a eight or one 8 year old lady, girl, that, hey, when you get to school, don't let any guy touch you. If they touch your skirt,
That's it.
all those things like
Yeah.
that. Now the girl getting to school, maybe her seat partner, a boy,
Hmm.
wants to touch her. Trust me, physically she might flare up and be like, my mommy said you should not touch me. Things like that. It's going to affect, and also they'll
Physically.
be like security conscious of what is happening around them. So it's going to affect it also. That's just it.
All right. Thank you so much.
Okay, so some people fear that their information will remain private if they come
Mm.
to the hospital to conduct tests that have to do with anything sex. So, how would you put the minds of the audiences at rest about the confidentiality of them meeting with medical professionals? I want to just help the audience and to feel confident that their information is safe because I have a friend that says he would never go to hospital for anything that has to do with sex. Because if he sees a nurse or the nurse is looking at him one kind of way that this one I think might do a test for. So help us put their mind at rest that there's confidentiality.
Okay, so like you said, confidentiality. In the medical aspect, in the practice, there's this thing that we call confidentiality.
Mm.
Like you can confide in your medical, like the professionals that are attending to you. Although we are still professionally, we might actually be having our issues with the medical practitioners about them keeping their patient or their client's information confident, like private, amidst themselves. But there are some issues also that might happen, that there must be a report or an incident report about it. Now, for an instance, maybe, don't let me use anything sexual out now. If during the time of Lassa fever and all, now because of the things that happen in the hospital, they have to raise awareness about it. But then the general populace um should be reassured as a professional, even when they are trying, if the client or a patient is trying to confide in you, you just have to reassure the person and be like, okay, this thing, don't worry about it. I'm not going to tell anybody. It's just for you to reassure and reassure again about it. And most people believe that every people wearing scrubs are actually medical practitioners. Don't let us forget that. Trust me, when you are seeing a certified or medical professional,
Mm-hmm.
they will always keep your information private. You will never see them doing you will never see them doing video about, oh, so fine boy age 26 came to the hospital complaining about this
Yeah,
thing.
yeah,
You won't see them doing
yeah.
that
I
online.
think I saw one.
But if there's a need for doing a research on it, in fact, doing research, medically, when they are doing research, when they are doing case study or incident reports, they will never write the full name of the patient or client. They might just write the initial, Mr. A. So, like, they are keeping the information private. In fact, if they want to do the awareness to the general populace, they will even keep the information, except if there are some sectors that need the details of the person. So we should just be like, as a citizen or a patient or a client, just be reassured that no one will actually put your information out there without a necessary like body requesting for it.
Okay.
That's
Okay.
just
So
it.
I am sorry to back that up. I feel like in the hospital there's this common thing. Yeah, we share informations. Maybe I miss her, so maybe why handing over, taking over. But I feel like healthcare professionals need to do better.
Yeah.
You know, you know, there is this part of the gossip
Mm-hmm.
that I mean that everybody knows the gossip. Even if you are not telling someone that there's a way you will hand over. And I've worked with people that they will just say, ah, is it the patient that is in ward B? He has infection now, and automatically
Everybody
everybody
A
knows
knows.
that he
stigma,
has
yeah.
infection. So I feel like professionals should be conscious of that. They should do better in
Better,
that aspect.
yes.
Please, yes, if you go, there is no nursing school, there is no MBSS, there's nothing you want to have that they would not even tell you that confidentiality is top notch. Why? Because of our patient's mental
That,
health.
yeah.
Because of the mental, because I mean, once the patient's mental health is tampered with, believe me not, other things might
The
not work.
Work,
trust.
yeah.
Yeah.
Yeah, might not work. More like, oh, like he said, Praise said, there's one of his friends like that doesn't like going to the hospital again because of there shouldn't be stigmatization. For example, now these labs, I'm just trying to back up what he said. These all these laboratory centers that we have, there are some people that this person is my neighbor, yeah, we live in the same, and this person is here with her what's it called, spouse. Maybe you know that this person has multiple sex partners,
Mm.
and they are getting to the hospital. Father
Another
Shala,
person.
is this why is you
What
understand?
about
So
sister?
please,
Yeah.
let's do
Conscious.
better, let's do better when it comes. And if even if you have incident reports, don't say my hospital where I work. You have to be
Professional.
emotionally intelligent as a medical professional. So I feel like that is for me.
And also to add to what, like, the imagination of your friend saying, maybe after seeing the nurse or something in the hospital you might actually meet the person outside. Trust me, as a nurse, most times once you're out of the hospital
Mm,
wall, you don't even remember the patient again. There's some incident like someone will just stop you on the way and be like, auntie, can you come down? Be like, okay, no problem. Just
That's reassuring. That's
like
reassuring.
something like that. So most times people like health professionals don't score or they don't picture your face into their brain because they meet a lot of people day in day out. So that's just it.
Okay. Sorry. I think I have two in one question now.
Okay.
You talked about one 8-year-old girl. I want you to like make it known to our audience that, or does it necessarily mean that sexual health or health education should be from a particular age? You know,
Mm.
there's this um principle, or how do I put that? Once you are 18 above, like you are licensed to like many things. So, at what age should community, parents, um, practitioners should like open children or people to sexual health? Is there a particular
Age
age?
range.
Yes, is there an age range? Is there an age range? Yeah.
So now we're talking about the exposure of sexual health. I feel it should start from the age of understanding. Once
Mm.
you understand, like once you know that this particular child can understand whatever I'm telling the her or him, like just try to expose them. No, there are some limitation. There are some limitation concerning sexual health when you are trying to tell told her about sexual health and what you are going to tell a teenager about sexual health. Now, most let me categorize it like for toddlers, for preschoolers or adolescents, you're going to tell them about um awareness. For teenager, you have to know focus about prevention or how to handle situation about it. You know, for all young adults, it's going to be another story on its own when you're trying to expose them to what sexual health is. So you trying to introduce sexual health to children, just introduce it according to their understanding. There's no need of you overfeeding them
Okay.
with unnecessary detailings of these things,
Yeah.
just as they're trying to understand it. No, okay, this thing, don't go to this person's room.
Okay.
But you know, when the person, like when the child is around 15 years, it's going to be another story on its own.
Entirely. Yeah.
Asking why?
Right.
Why shouldn't I
That
do
go,
this?
you know,
Yeah.
and when it's well, okay, when it's to the age of 20, 21, you know, okay, you might actually be sexually active. Okay, get your vaccines, do this, do that. You know,
All
that's
right.
just it.
Thank you very much. Then the
Second
second question
question.
is still relating to that. I think I'm enjoying it. You know, that's part of our vision. The inside MK, like we want to be like a voice between the health and the community. Now, sexual health doesn't necessarily mean it should be like, for example, now probably I have two children, and I realized that it's time that, like you said, when the child begin to understand, that is when I should start like inculcating the knowledge of sexual health. Is it like, how do I, as a parent that I don't even like, I didn't read about sex education, I didn't read about sex ed, is it that I will have to take my children to the hospital, or like how do I pass that knowledge to my children, or probably I don't know if you
So
understand.
to start
How do you
with,
educate them?
Yes,
to
how do
start
I
with, we
and
have
what?
to ignore the embarrassment that comes with, or the stigmatization that comes with
Topic itself.
the topic itself, like the sexual health itself. Trust me, as a parent, for you to give birth to those kids, you actually know something, even if it's just little,
Right.
about sexual health. And thankfully now, primary school, secondary school, they're already adding curriculums that talks about sexual health.
Health. Yeah.
You will see them talking, like you see some nursery rhymes talking about these things. So you know, schools, parent. Let me start with parents first. Like in fact, you have a little knowledge about it, just to give them a layman
Knowledge.
now. You check in their curriculum, maybe it's social study or I don't know what they call it now. No, they are going to teach them in schools, and also religious organization, also churches, mosques. There are some things that they will do. Children's Day program. There are no Children's Day program right now or things like that. They are no more like they're not more focusing on the fun aspects.
Mm-hmm.
Yeah.
They're not more focusing on the fun aspect of it. They are focusing on them gaining
Learning.
knowledge.
Knowledge, key aspects of
So we
life.
have to just bring these things to our day-to-day activities. And also you can there's one of this person, I was in a place last week and the person was saying that it's not until when the deed has occurred that's when you should need a therapist.
Mm.
You can actually expose children to counselors.
Mm.
for them to just have the exposure about these things. So it's not until when the bad thing has happened that's when you're going to expose them to the therapist. So we can inculcate the knowledge like from every spheres of our life. Church, no. Now, if you are building as a parent, you are building a principle that this is what I want my children should do in the house. Trust me, people around you they also agree with you. Now, for let me just use this example now. In your house, a married couple, you're already telling your children, maybe you have the last child is age 7, the first one is like age 15. No, you're already giving them these things, this knowledge, this exposure. Now, maybe their uncles, their aunties, they are around. Those people also know that this is the rule of this house.
Mm-hmm.
They're not going to go against it
Yes.
for you.
Yeah.
So they are going to give them more knowledge
Knowledge.
about it. So everybody they will say that it takes a community to raise a child.
Child. Yeah.
So you just have to do it all together. So that's it.
Thank
So
you very much.
about this STIs,
Okay, ma'am.
how long does it stay in the body? Number one.
Okay.
How long does it um the symptoms? How long does it take for you to know you are actually infected with the STI? Number two. Then number three, let's say for instance, I'm dating somebody and then um probably I contacted, or maybe let's say I was the one with the STI, then I got into another relationship unknowingly. I got into another relationship, like let me say 3 months. I was still unaware of my
Status.
yes. So can obviously I'm going to infect
The
the
other person.
person, but like, is the severity, is it that high, being the fact that it has been in my body for like quite some time?
So your question, the first question was
How long does
how
it take?
long does it take for you to notice? We have different um let me say diseases that you can contact from. So like earlier, I said there should be an awareness for routine checkups for us to know. Although there might be symptoms that we might ignore, it's just the awareness. Trust me, you're going like the person infected is going to notice some changes in their day-to-day life, maybe from vaginal discharge, things like fever and all like that. And also you're asked about how severe can it be. So if most of these infections are left untreated, trust me, they can cause a whole lot of things. Infertility comes in, different things. In fact, the infection on its own can lead to death
Hmm?
when you
Left
don't
untreated.
when left untreated. So it's just that's how it goes. And also the last question, you saying okay, maybe if the person contacted it from a
From
partner
this
and
STI.
moved on to another partner,
Yes.
yeah, the cycle will just remain the same,
Same.
you transmitting it all around. So that's where the routine checkups also comes in.
Comes in.
Once you know that you are sexually active,
Okay.
then the lab or hospital should be your um
Best friend.
go-to place for you to
Mm-hmm.
just check for your health, for your mental health also, and also for your psychological health. Now assuming it's happened in a university now, you moving from one partner to another, trust me, before you know it the news will spread and they'll start saying, oh, see that lady, she's the one carrying kinikon. And don't let us forget that the stigma will always rely on the lady, they will ignore
The guy.
the guy, even though the guy is also a carrier.
Yes.
So that's just it.
Okay. So me, I have two things: a contribution and a question.
Okay.
So I feel like religious leaders they need to do better when it comes to sexual health. We have campaigns, yeah, but I feel like they should stop making it look like, oh, people that are talking about it to their children are not good. And they should please, if there's a curriculum, I don't know if there's a curriculum, yeah, in church, they can also, because my church, more like a fellowship that I attend, we had a Valentine program, and that was for teenagers where we took them out to have fun, and yeah, it was discussed. Like it was even the pastor in charge that actually talked about it, and I was kind of impressed because now I feel like these things are getting better. So I feel like if they can do better, not like, oh, okay, the only thing you are here for is Bible, is church, is mosque, is this, is you get, is none of that. So let's add it to it.
Yeah.
Okay, if you do this might lead to this. Well, in some cases there will be like, oh, I don't want my child to, so when I start telling my child, peer pressure will come in, this thing will affect. But please, as much as you want to hide from that, it's better to tell the truth, create that awareness in them,
Then,
and not don't let peer pressure, don't let them
Make them
influence
do
them
it.
themselves. Because if peer pressure influence them, it's going to be negatively. I'm
Sure.
telling you. But it's better as a parent, as a community leader, as I mean
religious
the
leader.
religious leader, um tell them
Yes,
yourself,
sir.
preach it to them yourself, and tell them the what the damages that comes with having multiple sexual partners
Partner.
early what's it called, early
Exposure.
exposure to sex. And it's not like you want them to do it, but you
But
are
yeah,
just
just
telling
creating
them
Then,
in
awareness.
case they
They
are
do
in their
it.
own space or they have something related
related to,
to that.
yeah.
That is it. So for my question now is for adults,
Okay.
let me just put it that way, adults that are sexually active, not even sexually active, for every adult,
Okay.
we have routine tests, we have this. Can you please let us know routine tests we can do, more like, I mean, HIV, like, but we can do maybe probably once in a year, once in 6 months, just to be aware that, oh, you know what, I am safe for my partner. You get, and I believe if everyone is doing that, we will have less percentage. I mean, lesser percentage of infections,
Complication.
diseases, and the likes.
Okay, so when we are talking about the investigations that comes with we knowing our sexual health, mostly these things tends to face females more,
Mm-hmm.
although the male aspect also with people that there is, but we are trying to focus on a gender more. No, like now, always talk about the transmission of the infection right from the portal of entry to the pelvic region.
Mm-hmm.
That's PID. A lot of people will come to the hospital complaining about lower pelvic pain, all those stuff like that. And after doing the test, and all, that's when they will notice that, oh, you're having PID, pelvic inflammatory disease. And some people before they even voice out about these pains, it might actually affect the reproductive organs already. So like doing all those routine tests, just like I feel doing routine tests is about you going to a certified or professional hospital for it. There are different tests, and they like every year there will be improvements in the investigation to be done. I'm very sure before, like now they are doing this pap smear.
Yeah,
Mm.
just
Like the awareness is now
it's
more
more.
rampant
For pap
now, but
Yes,
smear.
5 years
pap
ago
smear
it
or
was not
HPV
really,
like
people
that.
don't focus on it.
Yes.
So you like I feel going to the hospital, a well not
A
a
standard
good
hospital.
standard hospital
Hospital.
for it, not one anti-nurse in your area.
Chemist and
Because going to anti-nurse in the area, you saying, "Oh, I'm sexually active," trust me, they'll just keep bombarding you with antibiotics,
Antibiotics.
mm-hmm.
and resistance will be like they like later on you will actually build
You're right.
resistance to those things,
Yeah.
and you're going to a standard hospital when everything has go like went south, like it's going to cause another issue again in
Mm-hmm.
the hospital. So you're going to a standard hospital confiding in your medical practitioner, that's the gynecologist, of course.
Mhm.
Okay, I'm sexually active. I don't know if there are investigations I can do, VDRL, things like that. In fact, to the list of it, that's the RVS for checking for your status, HIV status. A lot of people are actually carriers that we don't
We
know.
don't
There
know.
was this statistics that was raised last year in Lagos State,
Yeah.
and jokingly, I was sending one of my friend, and I was like, "Trust me." we're talking about this data. It's just those people that they've registered. There are a lot of
Yes.
carriers
That they are
that they
unregistered.
are very unregistered. So that's just it. So you go into this a standard hospital, confiding in your, in fact,
Gynecologist.
gynecologists, you go in there, they are going to list the investigations. There are some investigation that you might not do. So if I should recommend one right now, if you should go there, you might not need that
That one
one.
is okay, yeah.
So you just go into the professional.
It's the
They'll be
best.
the one to recommend and even interpret the results. Because if I should put it out here now, a lot of people will go there. Then who is going to interpret the
Oh,
results?
it's true.
So
Actually.
that's just it.
Okay.
Okay, now beyond the conversation regarding protection during sexual intercourse, what is your view regarding a responsible sexual behavior in the everyday life of an individual, or what would you advise should be the the to be a lifestyle of a responsible sexual behavior of an average Nigerian who is sexually active,
Okay.
aside from protection.
So aside from protection, there's one thing that we always ignore. That's abstinence.
Mm.
Mm.
Like the youth of nowadays, we always like we've ignored, like, let me just say it, we've actually left that group chat of abstinence to
It's
we
not.
using protection, which is actually nice. We have to express ourselves, and another way of expressing ourselves is through a sexual, like, or intimacy with your partner. Yeah, it's nice for you to use protection. So protection is the major and the cheapest, in fact, the accessible way of having a healthy sexual life. Also, there's communication. We also ignore communication when we're talking about sexual health. Okay, now communication is in two ways: no and yes. That's another thing that we always ignore about it. Then consent.
Mm.
We are having this issue of rape up and down, flying up and
Yeah.
down about the consent part also. When you're talking about sexual health, we are going to talk about the mental health also. Now, if there's no consent, trust me, it's going to affect the mental health of the person.
Yes. There is no
Like the
interested.
person that, like, let me say, the person that believes that he or she is the victim.
Mm.
True.
Mm. And
So
believes that he or
she
she
is
is
the
the victim.
like, that's it.
Believe. Okay.
So protection, the cheapest, the most accessible way of having a responsible sex. But communication, abstinence, consent
Consent.
is there also.
Okay. And so, finally, we know that there's this stigmatization that comes with HIV/AIDS patients, hepatitis patients. So, I mean, automatically, people feel like once you have HIV, you have AIDS. That's it. That's the end of life. So, I want you to leave how would I say it, a message for people carrying it out there. It's not a death sentence. So, help us leave a probably an encouraging, should I say, a word of encouragement for them.
Okay, so before I answer your question, I just remember another aspect of responsible sexual health.
Okay.
That's also the aspect of contraceptives.
Mm.
You know that you're sexually active, you can actually introduce yourself to things like that. Protection is different from contraceptive.
Contraceptive.
So that's just it. So for people living with one disease condition or the other, yeah, we've left the era of this is the end of life.
Mm.
No, we've left that era. There are ways now. In the past few weeks now, we've been seeing vaccines coming out left and right for cures of everything. So very soon, I'm very sure that we are going to get cure for all those things also. So you embracing it, there are a lot of people that they are doing fine. And in fact, you always want to be like, oh, let this person be my mentor. And they are having these things. Most might not come out to talk about it.
Mm.
So we're not seeing it as end of life. we embracing it and also being positive about it, because once you are negative about all these things, psychologically you'll be down. And the psychological aspects of an individual also affect the health. Once you believe that this thing is the end of life, trust me, there's no encouragement that wants to come from anybody that's going to motivate you again. So you've been positive about it, and you've been believing that okay, there's going to be um a solution sooner or later about it. So that's it.
One
Okay.
last question, please. Just one last question.
Okay.
Okay, so I believe we've been ignoring the fact that this self gratification, that's masturbation, from the male and the female. Some say, okay, I do this because I don't want to have in intercourse with the opposite gender. And in the clinical perspective, is it right? Is it wrong? Does it have negative side effects or positive side effects?
Okay, this topic on its own is another, like this question is another topic on its own. Trust me,
Okay.
we're talking about masturbation. We're talking about enhancement for sex.
Yeah.
We have different benefits that comes with all these things. Although there's this stigmatization that comes with it that oh, you doing this, you know, is it's sinful,
Mm-hmm.
True.
like you acting like they will just be like, if I should have a sex toy in my bag now, if anybody should see it, trust me, the judgments will be
I
there.
mean, someone was arrested because she had a sex toy in a university in Nigeria.
Oh,
I think you want. I saw it on the news a
wow.
few days ago.
So like the judgments will be there, but let's have it in mind that there's this health benefit that comes with all these things also.
Really?
Mm.
Yes, there are health
Interesting.
benefits.
I'm
In fact,
surprised
sex
about
toys and everything has been in existence way back before this generation. I think there's a research that was saying it since 15th or 16th century.
Century.
Mm.
Nice.
And medically, although Nigeria, we might not have adopted like that thing generally in our healthcare system, but things like that can boost sexual desires, people with low libido, people, people that are not satisfied with their sexual partner, that thing can affect your hormones. And
Mm.
also, so they might actually introduce things like that, okay, for you
Spice it up.
to spice it up, for you to hit your limits, and for you to just things, there are different things, crazy things that we all believe that they are sinful about it. So
But it's beneficial.
it's beneficial. So I'll just say maybe if there's a way, if the healthcare system can look into that aspect of we ruling out the negative aspects of these things, and we embracing the positive aspects of
So,
things
in
like
one
that.
sentence, does it do more harm than good, or more good than harm, or does it do no harm
Doesn't
at
do
all
any
So
harm.
now
to
the thing is,
individuals?
human brain are actually wired to we doing things that later on it might actually affect us psychologically.
Mm.
That's where the form of
Probably
addiction
have
comes in.
addiction.
No, when now okay, maybe they recommend a sex toy for partners for them to enhance their sexual life. Now they've enjoyed the thing. They're already having their normal way of life, but for them to just keep enjoying it, so there won't be any break between this excitement between them. No, they get addicted to it. So that's just maybe a psychologist or something that can come in the aspect of all these things can actually to help. That's just it.
Understanding.
Okay, so I'm very sorry. I have a last this thing.
Question.
Very sorry, yes.
Okay.
So how do we put a balance between, let's say for example, two partners that did like okay they're actually struggling for like to have intimacy, and like you said, that else to encourage something like that, and so probably those two partners go to the hospital and they like encourage them to, but they are a believer, and there's
There's this
yes. So
stigma.
how can it
How
be?
can we rule it out?
It's very
She
easy
was
to.
talking about religious leaders, community leaders embracing sexual health in our in
Community.
yeah. See this thing, we might actually have this war, or let me say this fight in our with our belief, our tradition, our religious
Culture.
culture. Trust me, most of the separation that happens
Mm-hmm.
most people don't want to talk about, don't voice out about the cause of the separation or the divorce. But now there's a statistic that says 16% of separation comes with sexual dissatisfaction.
Mm-hmm.
So we embracing it is not something to shy away from. Now I think we are coming up, we are already doing the early exposure of sexual health to our kids. So we're trying to embrace it among the married couples also. Just there are some counselors, we have sex counselors.
Right.
Although most of them are always in the private, they don't want to, because if I should tell you
People
that,
are
oh,
so
I'm
attached to
counseling
it.
people about sex, so it'd be like, you are a Christian, and you are heading this thing, all those things. It's
The
going to be
whole
like, okay, few months ago, I posted on my status that I have this inspiration of doing something, and if I should do it, it's going to be against my belief, my family, and all. And trust me, doing the major thing is just trying to focus on sex education, doing all these sex things and all. If I should voice, like when I told my friend, my best friend, he was like, have you prayed about it? No, you saying that. So we should embrace it. Counselors are there to help. Be open about it. Apart from the partnership that comes with being a couple, things like sex also matters, because if you're not satisfied in your bedroom, trust me, it will be physical, like it will be obvious to the people outside. So that's just it. And also we believe in Christendom, or don't let me use Christendom, we believe traditionally that after marriage you must have kids. So they'll just like have kids like that. No, there was this time I was still young, very then we went for a camp, and the person, both of them, they're medical practitioner, and she said after 3 months of marriage, they were still shying away from sex because they believe that it's something sinful.
Mm.
Medical practitioner
and they
after
are
3 months,
married.
and they are married, legally married though.
Okay, Ms. Ogunmola. In fact, I don't even feel like going on actually. But I mean, it's
Honestly,
quite insightful and
very
interesting,
insightful.
and very soon we'll call you back. I just hope you respond to us.
All right, ma'am.
And thank you on behalf of Side of Scare Podcast. So we have a diary, autograph diary for every of our guests. So
Okay.
please help us go through it in a jiffy and film. Thank you.
Okay.
We prayed about it.
Thank you so
Thank you
much.
very
You're
much.
Thank you so
welcome.
much.
So on behalf of the team, I'm saying thank you.
Thank you so much. I really appreciate it. Thank
We're
you,
so glad to
everyone.
have you.
Yeah.
Be glad to have you back.
Okay, so this is the end of this episode, and if there is one thing you should go home with today is that healthcare works better when people listen to the system. Thank you. I still remain Sims,
Eniola.
Ifeoluwa.
Praise.
and this
This
is
is
Inside
Inside
Healthcare
Healthcare
Podcast,
Podcast,
where
where
every
every
voice
voice
matters.
matters.
Right.